I have had a long history of being interested in history, I guess, for lack of a better phrase. I started my undergraduate career as a creative scholar, which is a program at Tulane that allows you to do a liberal arts degree and then come into the Tulane Medical School having completed a humanities-focused major. And so I did art history, and I saw this program that offered a little bit more of the humanities. It allowed me to continue my humanities focus a little bit and engage with how humanities and medicine can be intertwined a little bit more. And I really found a lot of love in the program. So it offered me the opportunity to really see how the history of medicine has really impacted how we practice medicine today, and these sort of historical things that have built the field of medicine. So there's sort of two tracks within the program itself. There's the more bioethics focused track where you spend a lot more time on bioethical theory, and then sort of the more medical humanities part where you do a lot of classes on, for example, like the history of law as it relates to medicine, and the history of like how diseases have been written about and talked about. And so I got to do a lot of writing and thinking very critically about how we conceptualize disease and conceptualize illness, and what that means in both the modern day and in the past. And so it ended up being a lot of writing and a lot of engagement with historical narratives as they relate to the modern day. It was full of a lot of being allowed to ask my own questions and to have dialogue with students. That was one of the things I really loved about the program. Was I was in my first and second year of medical school, sort of when I was completing most of my course material for the class, and a lot of first and second year you watch lecture, and that's great. It's really wonderful. We need to digest a lot of information as medical students, and there's not a lot of time for like group talking and all of that sort of stuff. Especially, we're not going to be able to be that helpful in contributing to the dialogue on scientific facts. But when it came to these classes in this program, there was a lot of, well, what do you think about that? Where does this come from, and why? Why does it matter that we care about animal ethics, or that we care about how we treat other people, or about what autonomy looks like in the real world, where we do face a lot of struggles with like the limits of where we can engage with autonomy and engage with like informed consent and things like that. And so there was a lot of being able to be around a lot of genuinely so intelligent, so kind, and so thoughtful individuals, both as students and professors, who were willing to allow me to say, well, why, and engage in that sort of Socratic dialogue. I think the one thing that I learned that I'm really going to take every step of my life forward is why. What does it mean to care? What does it mean to be in pain? Or what does it mean to face a patient and have to engage with what their rights are, and sort of the limits of having to, I want to go into psych, hopefully, maybe child psych, hopefully. And one of the things that's really difficult with children especially is the sort of tension that is indomitable in a relationship between a child and their parents, and especially in decisions that are life-altering in terms of healthcare. And so being able to ask, well, why is this way? Does it have to be this way? And what can we do about it? And where did this come from? Are all really important things to think about when you're looking at any individual ethical case.